Okay, quick review on glove use and hand washing. Hand washing is the most important thing that you can do so that you don't spread pathogens to food, particularly when you're making food for other people's consumption. Remember, we always have to handle food that we're preparing for other people very carefully. We don't know who could be one of those four that getting a foodborne illness could cause very severe or even death. So, hand washing is the number one way that we can prevent the spread of pathogens. So, make sure when you are washing your hands that you do so very well. I prefer personally the dishwashing liquid. It suds up better. I don't like the foaming soap that they put now in the dispensers. That's me personally. I just don't ever feel like it really does a good job. I feel like that foam disappears pretty quickly. My personal preference. It's just really important to make sure you focus on your fingernails in and around and under. Get that soap under your fingernails really, really well. Um, when you touch your cell phone is very, very dirty. We do try to wipe our cell phone down before we ever go into the food lab or touch anything. Obviously, using the restroom, handling raw meat, touch your face or your body, sneeze or cough. Also, when you handle chemicals, don't ever use hand sanitizer in place of hand washing in the food lab. You can wash your hands and then use the hand sanitizer. That's fine. Just don't use so much you get it into the food and cause chemical contamination. Make sure you wait for it to dry before you put on gloves. Your cell phone, it's really gross. It's nasty. You have touched it so many times with hands that have touched so many things. A lot of people take it into the bathroom. It's just gross. Quick clean. Wash your hands and then wipe it down with a disinfectant wipe. At least once a week, you should take it out of the case. Wash and disinfect your phone case, particularly if you have lots of grooves or little jewels or something like that, and it's not smooth. That's just lots of places bacteria and pathogens can hide. Focus on that home screen or anywhere that you touch it often. The hand washing sink, ready to eat foods, RTE, ready to eat. If you are handling foods that will not be cooked because they've already been cooked or they won't ever be cooked, you cannot do that with bare hands. So you must have gloves or use tongs or deli tissues or a combination of these things. You do not have to wear gloves when you are handling food items that will be cooked, but a lot of people do like to cut raw chicken with gloves on, and that's fine. Make sure that you're not cutting off parts of the gloves. I try to buy bright blue gloves for that purpose. And also make sure that you are not touching things with gloves on, that you've touched something gross, that you're cross contaminating. Don't open the refrigerator door. Don't turn on the water with the faucet. So just make sure that you're conscious about what you're touching, because it's harder to remember when you don't have it on your hands. When I cut chicken, I have chicken juice on my hands. You guys know from my demos, I almost always have a hand that I've handled food with and a hand that I've not. So that way I keep a hand for opening a refrigerator or turning on the faucet or whatever. So I have like a chicken hand and a not chicken hand. Same thing is important with gloves as well. So make sure that you're not spreading pathogens and cross contaminating with gloves on. People don't think about that, and I see it happen a lot. It's gross. So wash and dry your hands before you put on and touch the gloves. Make sure your glove size is correct. I have a whole bunch of them in the lab. Don't blow into the gloves. You're just blowing germs and pathogens out of your mouth, and then don't roll them to make them easier. Don't use them in place of hand washing. Don't wash them or reuse them. They must fit correctly. As soon as they become dirty or torn, if you switch food tasks, so I've been doing this food item preparation and now I'm doing a different one, change your gloves. Hand maintenance. If you're going to be a regular food handler, you should have short and clean fingernails. Long fingernails are harder to clean. Nail polish flakes off and it also hides dirt. Fake fingernails can come off into the food, and they are also a lot more difficult to clean, and they carry extra bacteria around. Particularly right now, there's a big trend in people getting little jewels on their fake fingernails, and that is just such a place to harbor bacteria. It's just not sanitary. So if you do have fingernail polish or fake nails, then you should be wearing gloves before you prepare food for other people at all times. So wash them very well and make sure that you have gloves on regardless of what type of food you're preparing. If you cut yourself, you need a bandage to stop the bleeding. So wash it, put some pressure on it, stop the bleeding, and put a bandage on it. And then you also need a glove or a finger cot. A finger cot is like a tiny little condom for your finger. I'm not a big fan of them. They kind of roll off. Sometimes they're helpful and sometimes they're not. Sometimes I think they're too tight and they kind of cut off circulation. So personal preference, I usually go with the glove. We also always wear hair covering in the lab, period. If you have a beard, then we can get beard ones. Nobody wants that hair. I don't want my own hair in my food, and I certainly don't want anybody else's, and we cannot serve food with hair in it. There are so many people in the food lab. We cannot have people shedding hair, and it happens all the time. So I got plenty of these type of caps. I try to buy the nicer ones that are not just like that little bitty tiny net. So I try to get the nicer ones that people can fit their hair into. If you have tight braids and twists, they are not really shedding hair, but they do still need to be pulled back so they are not dangling down into the food item. The bouffant caps are they should not be used with people that have extremely short hair. These are for people that have curls and hair that needs to go up into it. If you have a baseball hat with short hair, then that's fine. Don't put one of these on and then have a bunch of hair hanging down too. I see that girls that have like really long hair, they'll put a bouffant cap on the top and then they've got all this hair hanging down, and it needs to be tucked away, particularly when we're doing food labs and we're serving food to other people. Really important to watch for that hair. So if you're prepping food or working in an area, if you're in the lab at all, you also should have either a jacket or an apron on. Make sure that your clothes are clean. We do not wear our hoodies into the food lab. I know a lot of you all don't have anything on underneath of it, but people kind of wear them day after day. I do have lint rollers, so make sure we do some lint rolling. But you just got to keep your clothes clean. And a lot of people wear the hoodies without washing them every single time. An apron will protect the food and it will protect your clothing. So you should be wearing an apron. Make sure it's clean. Don't hang a dirty apron back up. If your apron is dirty, don't hang it back up. Put it in the laundry. I see that all the time. Don't wear a whole bunch of jewelry when you're preparing food. It harbors bacteria. I don't even wear my own engagement ring because I deal with food and I handle food. So a plain band is allowable, but you shouldn't have anything with a jewel and a bunch of stuff dangling down. So bracelets and all kinds of stuff. I even wash my Fitbit a lot and regularly, and I will even, when I'm doing food preparation, put my Fitbit up really high. So no eating, drinking, smoking, or chewing gum or tobacco. We don't smoke in there. You don't come to work sick. If you're vomiting, you have diarrhea, jaundice, sore throat with fever, you should not be preparing food, period.